party or in the street or in the restaurant or in a cafe, if you're not that, you are even a medical student, not even a doctor, a resident or whoever, then basically people will point at you like, look at this doctor, his hair is not, he's not well dressed, look at what he's wearing, look at his haircut, etc. So basically, whether you like it or not, I know it's a huge burden to be a doctor, but by the end of the day, that's what you chose, and that's what I chose. So basically, we have to respect our profession. To develop yourself all the time, continuous medical education, you have to conduct research, you have to read a lot, and through even publication to share the knowledge that you had from your research. To adhere the standards of practice. It's not a matter of, that's what I think, or that's what I guess. No, there's no room, as we'll talk on the medical errors later on session. You try to do your best to have your practice evidence-based. You have to follow the guidelines and the good clinical practice guidelines, and you should follow them for the sake of your patient. And this indeed will reduce the medical mistakes and errors. Abstain from any behavior or action that would question your credibility or establishing dishonest affairs with patients or their families. Sometimes you may have like a chance, okay, one of your patients is a very rich man or belongs to a very, rich family or someone who is important in the government. So you think, oh, you know what, this is a chance, let me make use of it. No, you should not, because this is going to affect the profession as a whole. Avoid the request of fame on the account of professional ethics and standards. Sometimes doctors do bad things just for the sake of fame, to be known that they do this or do that, to provide a role model for colleagues and patients, and even for the whole community. So basically, these are our duties, and we should reflect sincere devotion and dedication to the medical profession. Again, as I told you, your profession is your life, and the mistakes that you do does not reflect only in you. They don't come to say that Dr. Ahmed or Dr. Muhammad made a mistake. They come that doctors are getting bad. Doctors are not, these days are not qualified, etc. To avoid any action that could lead to contempt of medical profession and to maintain the standards of medical profession, to contribute to the development of the profession. There is no way. You should always try to make your practice better and the whole profession better. You should not take advantage of your professional position for obtaining any material or moral gains. As we said, like it's not a matter of to get rich or to get the fame, etc. So to take the appropriate procedure when it comes to know that one of the members of his team is sick, ignorant, or negligent of his duties, as we mentioned. The physician should refrain when dealing with patient from any act or conduct that would infringe the honesty and integrity, to avoid seeking fame at the expense of the ethics. Okay, then here we come that we should always remember that we are part of a community. We cannot isolate ourselves in the hospital and say that, okay, I deal with my patients, I'm good with my patient, and that's it. No, you have some duties toward the community in general, healthy and patients as well. Positive interaction with the communities at first. You have to be a part of your community and to interact positively with them. You have to protect the community by reporting reportable and epidemic diseases. If you have, for instance, like that, what happened in the H1N1 or H1N5, the avian flu, or any other kind of contagious or outbreaks that took place, you should report them. And again, there is a list of that notifiable diseases that should be notified. Improve the health of the community through advocacy and health education. This is very important, actually. You have to emphasize that your role as a doctor, you are not just a healer of a sick body. It's the duty to maintain the health, to promote the health of the people, to keep the healthy people healthy, or even better, to make the healthy people healthier. Not just to treat the patients, to make them healthy. And to involvement in community health activities. Don't say like, I'm a doctor, I can't go and knock the doors and distribute some brochures or talk to the people in the street. No, this is part of your roles towards the community. Rational use of the healthcare institution resources. Sometimes, especially when we're working in big hospitals, let's say it's okay, give them whatever, the fluid or use this ICU in any way, or it doesn't make any difference. Like any patient, if he has a headache, okay, send him for MRI or CT scan or something, because it's there and it's free, why shouldn't I do this? No, you should be rational when using the resources, because it does not belong to you, it does not belong to the hospital, it's for the whole community, and you are responsible for that. Effective contribution to the development of policies and health systems in the community. Again and again, you should work to develop the profession. You should work on developing the whole community. To be a role model, as we mentioned, in your attitude, again, in your religion, it's very important actually, and it's empowering. It would give a positive impressions if you are a practicing Muslim, at least I'm talking about Muslim doctors. The promotion of health equity among the society members, you should encourage that the health service goes for all. Maintenance of health resources and the ideal utilization of such resources, as we've just mentioned. Use your skills, your knowledge, your expertise to improve the standards and quality of health services rendered to the society. Okay, you have some rights. Just this is the good news about things that, okay, you have some rights as a doctor on the community in general. First of all, you have the right to respectful treatment by the people and to have your rights respected by other community members. You have the right to have continuous medical education, a setup within which you can work. So sometimes you are thrown in a rural area where there are very limited resources, and you ask you, why didn't you save this patient's life? And if you don't have the resources needed, then basically you cannot do your job properly. Not to be coerced by any means to do or abstain from doing work related to your profession. Not to be suspended or halted from practice unless unless within the limits of law and professional regulations. And you have the right to defend yourself if there are any claims related to this, and again in front of a discipline committee or even in front of the court. In case lack of professionalism, actually there are some, I would say, signs and symptoms of lack of professionalism. For instance, as we just mentioned, abuse of power, abuse when interacting with patients or colleagues, bias and sexual harassment, and breach of confidentiality, arrogance, offensive display of superiority and self-importance. I'm the most important guy on earth because I'm the doctor, working all the time with your white coat or your uniform, putting the stethoscope around your neck, and that's it. No, you should really be yourself and be modest dealing with your patient and colleagues. The greed, the money is okay. Let me say it this way: money is okay. You cannot, because this is the way you make your life. You're the doctor. You should have some fees. You should have some charts. You need a salary. You need to have, to earn your life. But when money comes to be the first and the most important and the furthermost drive for the practice of medicine, at this point of time, you lack professionalism, misrepresentation about lying, not telling the truth, manipulation, mispresentation of facts. The impairment, any disability that may prevent the physician from discharging his or her duties. So basically, you have to be professional enough. If you are not competent to do it, then say, okay, I'm sorry, I have to seek another specialty, or even quit the practice if that's what it takes, because I cannot anymore do my job. Lack of consciousness, conflicts of interest, and we will talk about that. This is the last section of the professionalism and the non-professional attitudes. The non-professional acts actually are divided into minor lapses, major lapses, and critical events. We're talking about, and we'll talk in more details about the medical error. Minor lapses are errors but have minimal consequences. Often there is no awareness of the unprofessional act, and there are many, may often be mitigated circumstances. For instance, if you're a resident, you're so tired, you just fell asleep, just like the guy in the back, okay, and you fell asleep, and just like in one of the stretchers of the patient, it shouldn't happen actually, but okay, it could happen because you've been spending the whole night, seeing patients, etc. It happens, so it's not a big deal. It's minor lapse, but it could be something could be more serious, unprofessional act. For instance, are errors but have serious consequences. Often there are awareness of the unprofessional act, and there are no mitigating circumstances. There are no reason why you did that. For instance, the resident refused to return phone calls or emails from a professor or or the consultant. He is trying to call you, he's paging you, but you do not respond, and you don't have a reason for that. Or for instance, there is an ER is paging on you and you do not respond. This is a major lapse. However, it could be even worse, critical event, a serious event that will require immediate action by your supervisor or the consultant you're working with. For instance, if you are being dishonest, you are lying to your colleagues or the patients, or hitting a patient or having a fight with a patient, and this is a critical event. At this point of time, your supervisor, your consultant should take action for that. Thank you.